Glaucoma, or in Hindi is called as Kanch Bindu. I am Dr. Goyal from Sanjeevan for Perfect Eyesight, Mumbai. Today's topic is we'll talk about glaucoma. Glaucoma is a chronic disease of eye which ultimately causes the vision loss. Glaucoma word has arrived from Greek word glaukos, that means shimmering. This is also called as silent thief of sight because silently, slowly vision damage can be done in this disease. It is also called as ocular hypertension. It means when the pressure inside the eye increases, then it's called as glaucoma. This problem may happen when intraocular pressure may be normal inside. Like how we have high blood pressure in the body, the same way we can have high intraocular pressure in the eye, which can lead to glaucoma. Like there is a fluid inside the eye which being produced in the eye only, will drained off outside with a natural process. If the fluid accumulation or the fluid production is more than the drainage outside, or drainage is slow, or the drainage process is closed down, whatever way the fluid get collected inside the eye can create the glaucoma. So there can be primary glaucoma, secondary glaucoma, congenital glaucoma. Primary glaucoma also can be divided in open angle glaucoma, closed angle glaucoma, normal pressure glaucoma. Open angle glaucoma means the drainage system is open, but by any reason, by degenerative process or any other reason, the flow is not very good to drain that fluid aqueous humor. That fluid is not going out of the eye, then it can create a pressure inside the eye and create the glaucomatous stages of glaucoma. In close angle glaucoma, when the angle from where the outflow is there of this aqueous humor is get closed by any reason, then the fluid is accumulated inside because the production is going on and the drainage is not there. So it give rise to the pressure inside or accumulation of fluid, give rise to the more pressure in the eye, intraocular pressure get more in the eye and give rise to glaucoma changes. Second is secondary. And before I go to secondary, there is some cases the intraocular pressure remain normal but still glaucomatous changes starts in the eye. Second is secondary. In secondary, certain things, certain diseases which leads to glaucoma, or certain procedures or certain medicines causes the secondary. They are secondary to these primary causes and leads to the glaucoma. For example, certain diseases like uveitis also can lead to the glaucoma. Diabetic retinopathy can also lead to the glaucoma. Central vein occlusion can also lead to the glaucoma, like in atherosclerosis and all. A trauma to the eyes and injury to the eye can lead to the glaucoma. Even the cataract surgery sometimes can precipitate in the form of glaucoma if the complication starts. Certain drugs are there which can lead to the glaucoma, mainly corticosteroids. By any reason, if we are using corticosteroids, either topically or orally or injectable form, if we use corticosteroids, can lead to the glaucoma, mainly the topical way. So there are many important types of glaucoma. There are several stages of glaucoma. Zero stage when there are hardly changes in the vision. Early stage, then the intermediate stage, then the severe stage and the end stage. Now what happens by increasing the pressure inside the eye that can lead to what? What are the signs and symptoms of this disease? Like in open angle glaucoma, when the pressure increases inside, can create a pressure to the optic nerve, the nerve which carries the message from eye to the brain. It gets affected by rise in intraocular pressure. That give a too much of cupping to the disc. That leads to the peripheral vision loss. And the vision loss can be increased if it is untreated, and that can give a vision loss or can give a blindness. In the case of closed angle glaucoma, there is either sudden or gradual closure of the angle is there from where the drainage is going on. A drainage happens normally. If that happens, that's called as closed angle glaucoma. In that, redness of eye can be there, painful eye can be there, nausea can be there, vomiting can be there, and headache can be there, too much eye pain can be there. That generally happens, and halos around the light can be possible. Then mid-dilated pupil. Pupil is a window from where the light goes from out to inside. That is, if it's say mid-dilated, sometimes it is generally round, sometimes it becomes oval also. So that's what may happen in closed angle glaucoma. Congenital glaucoma, and that family trees are there of the glaucoma, and it passes from family to family when they start getting glaucoma changes in the children. Now, what are the causes of glaucoma? Causes? There are many causes are there of glaucoma. As we said, by any cause, the drainage system get affected. Or I will say in the simple form, there are many things which can affect the pressure of the eye, mental tension, even myopia, hypermetropia can lead to the glaucoma. Diabetes can lead to the glaucoma. Any injury to the eye can lead to the glaucoma. So many medicines like corticosteroids can lead to the glaucoma. Sometimes the pressure remains normal, but still the glaucoma changes are there, as I said sometime before. And sometimes they have a family history. Then if the age is advancing more than 40, 50, they can have a chance of getting a glaucoma. So these things can cause the glaucoma. Now, how to diagnose this disease? The diagnosis of glaucoma can be done by eye examination. Dilated pupil, eye examination, you can see what is the status of optic disc and what is the status of retina. Can be seen by the eye examination. The main important examination is also perimetry field test. Generally in glaucomatous cases, the peripheral vision loss started, that goes from periphery to central, becomes like a tunnel vision. The person is OCT also can give us a OCT of macula and OCT of mainly optic disc. That gives idea of cupping and the rim of the optic disc. That is also a special tool. So by them we can diagnose the glaucoma. What is the treatment part of the glaucoma? Orthodoxically, in allopathy, treatment is either can be given drops or can be given laser or can be surgery. Drops, the motto is to lower the pressure which is being built up inside the eye. There are so many type of drops coming which can help the patient. But people have to take permanently and then has to see if it is going more, then they have to increase the more drops and they have to go accordingly. In laser, they create a new passage for drainage, they increase the area of the drainage more. So, but they are all temporary ones. Sometimes whatever drainage they make, that can also get closed again. So the third is surgery, they trabeculotomy, or they create a passage by that the fluid from inside can go outside. But sometimes they get clogged up, the passage which we make, and sometimes they have so many complications after that. In Sanjeevan for Perfect Eyesight Mumbai, we have integrated method for treatment of glaucoma. Like as we have talked in so many videos, we have plenty of integrated methods here. where there is no operation, no laser, no LASIK, no steroids, no antibiotics, which releases the tension of the brain, which improves the vision of the person, which can improve the peripheral vision of the person, which can reduce the pressure of the eye, which can make the eyes more comfortable. So many things can be done with this integrated method. So maintain the pressure. What are the complications like optic nerve damage and all can be prevented. Peripheral vision can be taken care. If the person is following good habits of the eyes, which we had talked in other videos, they also help in maintaining the optic disc, retina, eye health, vision, peripheral vision. So by these integrated method, without surgery, without laser, without any steroids and heavy medications, we can give a lot of support to our glaucomatous patients. What is the prevention of this disease? Prevention is following the good habits for the eyes, reduce the mental tension. If any blood pressure problem is there, to control the blood pressure with the medication. Diabetes is there. Diabetic retinopathy can lead to this problem afterwards. So to control the diabetes, and best way is maintaining the good body and eye health, which can be done in the Sanjeevan for perfect eyesight movement. So today we will talk about glaucoma this much. See you in the next video with the other topics. Thank you so much. You can contact on 9324240702. You can visit our site www.sanjeevan.in, or you can contact us on or mail us on info@sanjeevan.in.